Good afternoon, everyone. This is Dr. Kyle Olson with Chiropractic First of Rockford. I hope everyone here had a wonderful 4th of July holiday. I want to take the time and just remind you that vitamin D through the sun is one of the most powerful vitamins that you can have in your body that's made naturally with sun exposure. So hopefully you got the chance to get out, get some vitamin D and some fresh air in your lungs this weekend. What I want to talk to you about today, though, specifically is pregnancy. Pregnancy is something that it's been on my mind a lot, in part because I now have three children under the age of 5, and my most recent one is only 4 months old. And so I've seen what my wife has gone through during these 3 pregnancy cycles over the last half decade. And we see lots and lots of pregnant women here in the office, both before the pregnancy, during, and even after the pregnancy as their families receive care. But what I want to talk today specifically is about pregnancy and some of the kind of unknown or maybe unexpected to some people complications of pregnancy, which is back pain. Back pain or sciatica that wasn't there beforehand, or maybe wasn't as intense beforehand, but then when the pregnancy rolls around, even in the early stages, it can cause an exaggeration of that or an onset of that. Now, a woman's body during pregnancy goes through a lot of changes. That's not a secret. Most of those, or some of those, are very visible. We see those when a lady's going through that. However, there's a lot of things that we don't see, but they're still well known. So morning sicknesses or headaches, things like that. You hear about that as being a common symptom, but what a lot of people, a lot of women, a lot of couples aren't prepared for is that they could start to experience back pain. And that can be everything from a minor ache or pain to very severe, even debilitating sciatica or back pain at times as well. Now, during pregnancy, there's a lot of hormones that change. That's not a surprise, but one of the key ones I want to talk about is called relaxin. Now, relaxin is a hormone that's made primarily during the first trimester, as well as right before the delivery happens. As the name kind of implies, it helps to relax within your body. Now, it doesn't help you relax, but it helps to relax the ligaments in your body. And this is so vital because it helps to open up the pelvis, make for a much smoother delivery, and it helps your body move a little bit easier as you're starting to put on additional weight as the child grows. Now, relaxin, though, in addition to relaxing the pelvis, what it also does is it actually affects ligaments throughout the whole body. And what that does is it can create instability in areas, specifically in your lower back or other joints as well. And if there's already an underlying issue or an underlying injury maybe that was there from before that you didn't know about, it can actually exaggerate that. And that's where a lot of women will start to get pain in areas that they didn't know they had, or something that maybe they had years ago, but then it flared up once they got pregnant again. It's this hormone relaxin. And it comes at different times, but again, the first trimester and the right close to delivery are when that's at its peak within your body. When there's more ligament laxity, your joints aren't as supported as they were before. And as the child grows and the center of gravity is pulled more toward the front in the belly, it'll oftentimes strain the joints in the low back, which puts additional pressure on the discs, the joints, and specifically the nerves. And that's where the pain comes from. And so it's not uncommon that we see women coming in during their pregnancy because they're looking for help. And because the options are so limited for pain management during that time, you simply can't take the medications that many people were reliant on beforehand, and they're left high and dry by the medical system at that point. And they're just given recommendations or stretches. Those can be extremely important and helpful for many, but for most, there's something more that needs to be done, which is to help the body strengthen and stabilize those joints. And through that, we're able to see incredible changes, reduction in pain, less stress on that body, less stress on the mother, and ultimately on that developing child as well. Now, pregnancy is such a special time in a woman's life, in a couple's life, in the family's life as it happens. But it is such a unique time as well. Things happen then that will never happen at any other time or any other period in a woman's life. So that change, it's necessary because it helps deliver the child, and that's the goal. But there's so many people that experience pain during that time or can pinpoint the pregnancy and delivery as a time where it changed for the worse and it just never got better, even all those years later. If you are a woman who's pregnant and you're experiencing pain, whether it's new or just made worse because of the pregnancy, if you know a woman who's going through that and is looking for options, or if you are somebody who witnessed or experienced that during pregnancy, but now it's been several months or several years later and you're still not seeing the improvement or the return back to normal long after the relaxin is gone, there's still likely an injury on your spine that can be addressed. Find a chiropractor near you who can address those with you. If you need us, we are here. We love to help families get healthy, and it starts with the mother most of the time. So with that, keep an eye out. I want to do a couple more videos about pregnancy, not just what causes back pain, but how you can go about addressing this, both with chiropractic, but also with stretches, nutrition. You're going to see all that stuff. So keep apprised of these videos here over the next several weeks. If you like this video, please feel free, share it with the people that need to hear it most. There's a lot of people looking for answers for this issue. Share it, like the page. We always appreciate it. I love seeing you guys again. Have a wonderful rest of your week. Stay cool, stay hydrated. It's going to be a scorcher for a few more days. I'll see you next time. Have a great day.